Okay, hello everyone. My name is Carissa Hosevar. I am the Development Director for the Ehlers-Danlos Society, and I will be filling in for Jessica today as your moderator. For our webinar today, we have Cynthia Perry presenting on how to keep your sanity when your health is insane, managing EDS and HSD with multiple comorbidities. This webinar is part of our ongoing series, Living with EDS HSD. A quick note about how this webinar is going to work. Attendees are muted at all times. However, you are able to type questions into the question box at any time. Cynthia will not be able to see or respond to any questions until the question and answer time at the end of her presentation. Please do not send your question more than once, as it will not increase the chance that your question will be answered. It will only make it harder for us to sift through the questions. This webinar is being recorded and will be uploaded to our website and YouTube page within a couple of weeks, barring any technical difficulties. Cynthia has many diagnoses, including EDS, mast cell activation disorder, a primary immune deficiency, and Hashimoto's. She is also a breast cancer survivor. As a result of these conditions, she became disabled when her employer decided she was having too many medical appointments. Cynthia Perry has a BS in Applied Math and an MBA. She worked in a variety of industries. Her last 8 years were in the medical device field, interviewing doctors, conducting market research, and doing strategic planning work. In these roles, she learned to present complex information in easy-to-grasp formats, appropriate for leadership teams. Looking for ways to continue to use her research and presentation skills in retirement, Cynthia writes articles and teaches seminars focused on healthcare for people managing chronic illnesses. Thank you so much, Cynthia, for being here today.
Thank you. Hi, everyone. So we're going to be talking about how to keep your sanity when your health is insane, as Carissa said. That's me. I live in Denver, and I spent 8 years working in medical devices, interviewing surgeons and other healthcare providers. But I just want to remind everyone that I'm not a doctor or a healthcare provider myself, and also that my experience is from the US perspective. So with that, we'll get started. I do have a couple of books that I've read along the way that I really want to recommend to all of you. One is What Patients Say, What Doctors Hear by Daniel Ofri, MD. And it's a really great read about the doctor's perspective on taking care of patients. And then the other one is How to Be Sick by Tony Bernhard. And it's really a Buddhist philosophy on kind of accepting our illness and the fact that it's going to ebb and flow over time, and being really grateful for the good days that we have. So what we need to do to get started in managing our chaos, creating order out of chaos, is to gather our medical records. And this would include tests, imaging, and records related to any of our major diagnoses, blood work as far back as is relevant for our diagnoses, surgical records, emergency room records and urgent care records, records from our doctors that we're no longer seeing, and records of doctors who might be closing their practice. Now, in the United States, doctors are required to keep records for 7 years. And so this is why it's important to keep records ourselves. And also, when I was diagnosed with immune deficiency about 12 years ago, it was really important to have the blood work showing that I am immune deficient. But once I started on treatment, my blood work doesn't show that I have, or doesn't show that I am immune deficient anymore. And so it's really important for me to have those records in multiple places showing that at one point I did test as immune deficient. Otherwise, insurance companies might come back and ask me to take a break from treatment in order to prove that I still need treatment. So that's a really important point to make as well. Especially because, as I said, doctors are only required to keep records for 7 years. And these records that I have go back 12 years at this point. So after we've gathered the records, then we can create a medical summary, and we can use this then for new patient forms, for meeting new providers. We can bring it to the emergency room or urgent care, and we can give a copy to family and friends. The new patient forms is really nice because instead of having to fill those out over and over and over again, we can just say on the form, see attached, see attached, see attached. And this is probably hard for you to see, but some of the things that we would have on here are name and address, next of kin, our date of birth, contact information, email, our pharmacy, the name, phone number, and address, because that can be hard to remember, and often doctors ask for that. Any current doctors that we're seeing, their name, specialty, phone number, and address. Other consulting doctors that we might have seen in the past. So if we saw a geneticist long ago who diagnosed us with EDS or HSD, then we might want to include that. Blood type might be a good thing to include. Drug allergies or any allergies medical related. Also diagnoses and chronic health issues and the year and month that we were diagnosed. Current regular prescriptions and the reason that we take them, and any major side effects experienced, any surgeries and hospitalizations that we've had, and then tests and biopsies and the year and month that those were done. And this is just an example. You might want to customize it for yourself. It can go into multiple pages, and mine certainly does at this point. And I've done them for myself and for my children as well. Then we can also build medical binders, and these we can take with us to appointments, and you might want to include in that records related to the diagnoses, letters from specialists, imaging reports, blood work, and you can organize them by year, you could organize them by diagnosis, by type of test, or you could have multiple binders organized different ways. Certainly when I was going through cancer treatment, I had a binder dedicated just for my cancer treatments. Tracking symptoms is an important thing to do. I couldn't make this up if I wanted to. These are all real. So there are some smartphone apps out there that are good, just examples for tracking symptoms. There's one specific to diabetes called Gluco, and you can get it for iPhone and Android. One for migraines, which many of us do suffer, called Migraine Buddy, also iPhone and Android. And then there's a pain tracker diary that's also for iPhone and Android. And you can see kind of how it works here. So I encourage you to go and look for apps like this specific to your needs. And then that you can print off reports and kind of show them to your doctors so they can understand what you're dealing with on a day-to-day basis. So there's so much to tell, and doctors can only hear so much, especially in the United States. We're being limited to 15-minute appointments, if we're lucky, 30 minutes with a specialist. And so it's really critical that we get organized before we go into an appointment. So one of the things that we have to do is really get focused, and what is it that we really want to talk about in appointments, or maybe we can't even deal with everything going on in our lives and our bodies at one time. So if we have multiple things that we're dealing with, we might want to deal with a torn ligament first, for instance, because that's kind of urgent. Then maybe if we have POTS issues, we want to move on to that next. And then maybe last, we'll deal with GERD if that's going on in our lives. Not to say that they're not all important, but maybe we're still trying to work, or we have other things going on in our lives and we just can't deal with all of these at once. Or maybe a doctor isn't even willing to give us referrals to deal with all of these all at once. Or we could also look at it by symptoms. If we've got vertigo issues, those can be very disorienting and interfere with our lives. So maybe we want to deal with those first. And then for me, I know insomnia, if I'm not sleeping well, that's really a problem. Hypo or hyperthyroid problems can interfere with that, but pain can also interfere with sleeping. Any number of things can interfere with sleeping, and I'm really a big proponent of making sure that we talk to doctors about how our sleep is going and ways that we might fix any sleep problems that we're having. And then maybe after we deal with those two things, then we can move on to the joint pain issues that we're having. So that is some of the ways that we might triage our conditions and try to get our chaotic medical lives under control, is just kind of chunk the issues that we're dealing with and not try to deal with everything all at once. It's also important to establish treatment goals. I love Yogi Berra. If you don't know where you're going, you'll end up somewhere else. So we need to know when we're going in to talk to a doctor what it is that we're trying to get them to solve for us. Are we looking for a partner to manage a chronic condition? Are we looking for a surgical opinion? Are we looking for a second opinion? Do we want a new approach because what we've been doing isn't working? Are we looking for a cure? Sometimes a cure is a reasonable goal, and sometimes a cure really isn't a reasonable goal. So it's really important to know what the options might be and what it is that we're trying to accomplish. Because again, we only have maybe 15 minutes, maybe 30 minutes if we're lucky, to convey what it is that we're trying to convey to a doctor, especially if we're meeting a new one. Another thing that I really encourage people to do is to set an appointment agenda and actually write it down if we have a lot of things, type it up, I should say, even if we have a lot of things that we want to go over with a doctor. And this could include the treatment goals, any new symptoms and concerns that we have, changes in our condition since the last visit, other providers that we've seen since the last visit, recommendations that they've made, prescriptions that they've given us, medications, side effects that we're experiencing, research that we want to share with them, tests or referrals that we want from them, and prescriptions that we need if I have and go over them by Willie, but if I have a lot that I want to go over, I'm actually going to type it up, organize it well, and then share that with them, make a copy for myself, make a copy for them, and go over this with them line by line in the appointment. And hopefully then we can kind of, again, try to get some control of the chaos going on in our lives. Next, we need to build our medical team. Who's running this show anyway? Is it us? Is it the doctors? Is it a combination? Hopefully we can create a partnership with our doctors. So there are some ways we can go about selecting providers that will work for us. We can ask our primary care provider and other providers for recommendations. We can talk to our family and friends. We can use local top doc rankings. And in Denver, we have a magazine called 5280 that ranks doctors every year. And these are doctors rating doctors. So that's a good source, but not the only source. And we can use websites. In the United States, we have Health Grades, Yelp, Nextdoor. We can visit providers' websites and read their care philosophy, education, research interests, etc. And I recommend speed dating until we find a match if we're looking for somebody for a long-term relationship. And we may even need to go out of state to find an expert. For instance, if we're dealing with Chiari malformation, or syringomyelia, or mast cell activation disorder, or something complicated like that, where there aren't very many experts, we might want to go out of state to find someone. Here are some example physician profiles that I think really give us insight into some doctors' personalities or practice personalities. So clinical interests include cardiovascular disease, complex medical conditions, diabetes, geriatric geriatrics and preventative health through exercise, nutrition, and weight management. A strong advocate for prevention as the best form of medicine. Another one is your comfort is our main concern, and you need effective long-term solutions. We take the time to help you take back control of your life. Well, that sounds really nice, take back control of your life. Up here, complex medical conditions, that sounds really great for someone dealing with a lot of complex medical conditions. And then here is an oncologist with doctorates in both genetics and medicine, offers the patients in his care a dual advantage as they fight cancer. He has collaborated with researchers and specialists in the nation's leading institutions in his 20+ years of practice, working to develop tumor-specific treatments for better outcomes and fewer side effects. So I think that going and reading what these doctors say about themselves, or in this case about their practices, can be very insightful actually, and help us find someone that might work for us. When we meet providers, again, it's really important to be organized. We're not going to have a lot of time. So we make an appointment, bring our medical summary, acute and chronic issues, state our treatment goals, bring that appointment agenda, discuss how you would like to partner with the provider, ask if they're willing to take you on as a patient. I think it's really a good idea to ask directly after you go over your medical history and what your goals are. Sometimes they will refer you on to someone else very overtly. Sometimes in a more discreet way, they'll say something that will make you realize that they don't really want to take you on as a patient. You can ask the best ways to get urgent care when their office is closed. You can and should thank the provider for their time. And as I said, you can speed date multiple providers. And to do this, you just make an appointment. And because most don't do meet and greets anymore. And then don't be afraid to move on to other providers if this just wasn't a good fit. If you're looking for a specialist for long-term relationship, it's not a bad idea to meet at least 2 providers and see who you like the best. Then something that I've discovered too is that it can be tricky to negotiate specialist boundaries. So for instance, if you have scoliosis, you might be dealing with a spine surgeon, a physiatrist or pain management, and maybe osteopathic manipulation. And they may have different approaches, philosophies, and treatments, and you may find yourself having to tell each of them what role you want them to play in your care. And it can take a very long time to realize that these interrelationships are kind of causing some issues in your healthcare, and then informing the providers of how you want them to manage your care, what you want those boundaries to be, really takes grace after you've recognized that there are some issues coming from this overlap here or here, here or here, these Venn diagram overlaps. And sometimes we end up with a hot potato, even though we have a lot of doctors no one wants to deal with, or we just don't know where to go. So for instance, food allergies, you could end up at a GI doctor or an allergist, or abdominal pain. Sometimes we just don't know where to go. So for symptoms with overlapping medical specialties, I would say start with your primary care doctor and see where they think you should go. And if the first specialist that you go to doesn't have a solution for you, ask them where you should go next. And then report your progress or lack of progress back to your primary care doctor. And if you're just not getting solutions, I think that the primary care doctor is going to be the person that you go back to keep saying, we're not getting any answers, I'm not getting any better. And if that primary care doctor isn't working for you, then you might need to find another primary care doctor. Also, something that comes up is, depending on where you get your care, doctors may expect you to be the conduit of information between them. So if you're not in a university system or a Kaiser HMO as we have in the United States, and you're just picking and choosing your specialists at different provider organizations or private practice, they may actually expect you to be the conduit of information. And sometimes this is so they don't offend each other or step on each other's toes, or so that we don't end up in this Venn diagram type situation. And so this could happen, for instance, if you are having shoulder problems and you have a shoulder surgeon and an osteopath and a primary care doctor and a pain doctor, and they may actually say to you, well, the next time you see your primary care doctor, please tell them this, or the next time you see the osteopath, please tell them that, or ask them this. And so it's not because they're lazy, it's just because they're trying to manage this complicated situation. Sometimes they're really good at updating each other via letters, but not always, and especially if you've got a complicated situation like this going on. And also remember that you can fire a provider, even one that you've had for a long time. Good reasons to fire a provider are if they won't listen, if they aren't taking your concerns seriously, if they won't answer your questions, if they don't treat you as a partner in your care, if they aren't making you better, if you've lost confidence in them, if their referrals aren't working for you, if you just don't click with them, if your styles don't match well, if there are billing issues or office staff issues. And also I'd add to this, if you have to wait a long time for it to be called back for your appointment every time that you go to the office. And how do you fire a provider? Well, first of all, I'd find another provider so that you're not left without care. Then I'd get your records from that provider and give them to your new provider. There's not usually a need to explain anything to the prior provider if you don't want to. But if you do, if you want to give them feedback, then you can write a letter explaining why you left. But I'd be brief and succinct and professional, and not really burn any bridges. If you really want to report them, you can report them to the board in your state, and the board will investigate. And you can go about it that way without pursuing legal means at all. Also remember, though, that you can be fired. And among the reasons nearly 800 practices surveyed gave for cutting ties with a patient were that they were violent, disruptive, or had inappropriate behavior towards doctors and staff. There was a violation of policies related to chronic pain and controlled substances. There was a failure to show up to scheduled appointments, a repeated disregard of doctors' medical recommendations, and a violation of bill payment policies. So also, researching conditions is an important part of our lives, I think, and a good partner doctor that we have will take a look at research that we bring to them, provided it's good research. So it's an important thing to talk about, and that is evidence-based research. And as we move up this pyramid of good research, we have more patients and more controls in the research, and this brings us more level of evidence. So this comes from the Center of Evidence-Based Medicine, Levels of Evidence for Therapeutic Studies. The lowest level of evidence is editorials and expert opinion. Then we have case series or case reports. These are going to be based on very few patients, usually just 2 or 3 at the most. Then we have case control studies, cohort studies, which follow a group of patients over time, but again, not usually very many patients. Randomized control studies is really the gold standard. And then systematic reviews often reviews a number of randomized control studies and summarizes them. So if we bring this research from the top of the pyramid to our doctors, and it's from a peer-reviewed medical journal, they very well might pay attention to it and say, okay, yeah, this is something that I'll read and take into consideration for your case. So how do we do medical research? Dr. Google, information at our fingertips, but not all information is created equal. So I just typed in lupus into Google and all of this information came up. We have information from Mayo, from the Lupus Foundation, from the American College of Rheumatology, from Lupus Research Alliance, from Verywell, and from Medical News Today. So if we look at this, the reliable sources of information are going to be, number one, probably American College of Rheumatology, and this is how doctors are going to view the reliability of the information. Then we've got Mayo Clinic, even though it's geared towards consumers, Mayo is very well respected. Then we've got the Lupus Foundation of America and the Lupus Research Alliance. And then number four, as far as reliability, Medical News Today and Verywell Health. They may be reliable, they may not, I'm not really sure. They're definitely geared towards consumers as opposed to towards medical professionals. So we can also find these peer-reviewed articles, journal articles that doctors will really pay attention to by using PubMed. This is pubmed.gov. And here I typed in fibromyalgia and found an article, Fibromyalgia, a clinical review. You can click on it. You may have to pay for the article. You may be able to find some ways to get the article for free. Then I would also encourage you to not be intimidated by medical terms. You can use Google to look up any terms you don't know. You can have multiple windows open in your PC so you can flip between the article and Google to look up terms. You could use your phone to look up terms while you're looking at the article on your PC. You could actually purchase a medical dictionary, kind of old school, but they could be kind of helpful. And as with any new language, you will build your vocabulary over time. So just be patient with yourself as you learn these terms. Then I want to remind everyone that really you are in control of the treatments that you get. Your doctor makes recommendations, but ultimately you get to decide whether or not you accept those treatments. So there is something called healthcare economics, which is the study of how economics and healthcare and society kind of come together. And we all naturally make trade-offs between quality and quantity of life, whether we know it or not. And economists actually aim to measure this. So there's a term called QALY, Q-A-L-Y, and one QALY is a year of life times its utility value. So 1 year of life in perfect health equals one QALY. A half year of life in perfect health equals half a QALY. And 1 year of 50% health also equals half a QALY. So when we think about, for instance, cancer treatment, we think about how long that treatment might extend our lives and the side effects that we might experience while we're going through treatment and whether that's something that we really want to endure. And every treatment that we might have is going to have side effects. And so we think about either consciously or unconsciously the side effects that we're going to have to endure. Or sometimes it's monetary. How much money is it going to cost our family or our lifestyle in order to keep up these treatments? There's also a term called polypharmacy, which is when we get into taking so many medications that they start to interfere, interact with each other. And the best way that I know of to avoid this is to fill, if possible, all of your prescriptions at one pharmacy and or with one doctor, so they will catch all possible interactions. Also, know why you're taking every prescription and take only those most necessary for your ongoing health. And talk to your doctor about whether one drug could replace two or more that you're already taking. Make sure that new symptoms that you are having are not caused by new drugs. So maybe keep a diary about what's going on and think about whether it started after you started taking a new drug. Also, I think start just one new drug at a time whenever possible. It's not always possible, but if possible, kind of stagger the new drugs that you're going to take. And think about whether your doctor is recommending avoiding drug classes as you age, such as drugs that might contribute to dementia. And rather than rejecting a new drug, consider a trial. You ask a lot from your doctor, so maybe you can take one for the team. So if it's something that you really aren't sure you want to do because you're afraid of side effects, maybe rather than rejecting it out of hand, could give it a try and see if it might work for you. If you cannot fill out your prescriptions at one pharmacy or with one doctor, there is a place where you can check drug ingredients and also interactions. So first we'll talk about ingredients. Some of us have drug sensitivities to ingredients or even allergies to ingredients. So for instance, I'm very allergic to pork, and it turns out that gelatin, of course, is in drugs, and that is pork. And also there's an ingredient called polysorbate 80, which is made with animal fat, which could be any animal fat, but is often pork. And if I get a little bit of pork, it's not going to be a problem. But if I stack multiple drugs with pork, then I'm going to start to feel some sinus symptoms. And then I need to back off of how many drugs I've got with pork in them because I'm getting too much pork on a daily basis. So this is a good place to go to check this. And it's dailymed.nlm.nih.gov. There are other places that you can go, but I've found this DailyMed a very helpful place. And then there are multiple places you can go to check drug interactions, but I like drugs.com. You enter the drug name and you keep adding all of your drugs and press add, and then you can click and check for interactions, and you can actually store your drugs on there and update it on a regular basis as well. Non-compliance, I think, is an important thing to talk about. If you try a drug and you didn't like it, or tried some kind of therapy and didn't like it, you need to tell your doctor. You can explain why you've been non-compliant, and maybe you and your provider can come up with a plan B. Remember that you can be fired for non-compliance, and you may want to find a provider with a philosophy more in line with your treatment goals if you can't agree on a plan B and you just can't tolerate the treatment that your provider was recommending. So wrapping it up, in communicating with our providers, I think it's really important to remember that many providers are limiting visits to discussing one or two issues, and this can be for insurance billing reasons. So it can be really frustrating to us, but I have had doctors actually hand me a form and say, what's your first issue and what's your second issue that you want to discuss today? And complex patients might benefit from making appointments every 3 to 6 months to bring their primary care provider up to date. And in these meetings, you might want to review what specialists you've seen and what they've recommended, medications that you're taking and side effects that you're experiencing, how well the team that you've built is working, and whether any new specialists would be beneficial, how you're holding up under stress of dealing with complex and chronic health issues, and if there's anything you can do to reduce that stress. Maybe it might even be time to add a counselor to your team. And then also remember that often your providers are open to email communications between appointments that can really reduce the burden on you and on them. If it's not going to take them long to respond to an email, they might actually prefer that to having you come in for an appointment. So that's an important thing to kind of work out with them as you become their patient, and it might change over time too. It's also important to thank your providers. 34% of surveyed doctors find patient relationships most rewarding, and 32% are most rewarded by finding answers and diagnoses, which means by helping you. So just remember that although we're complicated patients, we are actually patients that our doctors can really feel rewarded by helping. So this is actually a card that I sent to my doctors when I was told that I was cancer-free. So I sent it to all of my care providers that helped me through cancer, and there I am in my pink wig. I still didn't have any hair. I wore the same shirt for every picture. It was a special shirt that a friend gave me to help me fight cancer. And the doctors didn't know that I was taking these pictures to collect and send them a card. So it was fun. They all appreciated it, celebrating victory for Team Cynthia. And also in the United States, at least, National Doctors Day is March 30th. So it's a great day to thank your doctors, to send them a card, to maybe bake something for them if you're a baker, or just to recognize them in some way. It was made official by George H.W. Bush in 1991. And also, I want to remind everyone that it's important for us, for ourselves, to take a break. And I call this a medical vacation. And I take them when I can, for as long as I can, safely take a break from my healthcare providers. And so this is a planned break where I purposely don't schedule any medical appointments, including physical therapy, if I can do it. And it might be just for 2 weeks, it might be for a month. I don't think I've probably ever made it longer than 2 months, but it's just a wonderful time to enjoy that things are going well, that my body and I are getting along, and just to enjoy other things in life and the time that I'm not spending in doctor's offices.
Okay, thank you very much, Cynthia. Do we have any questions? We are now open for questions. We have one. Do you have any advice on how to find doctors that understand EDS?
So again, I would start with your primary care physician or a geneticist and see if they know anyone. Actually, I have a physiatrist who is caring for a number of patients with EDS right now. And when I met my new primary care provider after my old one retired, she said, well, I think I might have EDS myself. So I think it's becoming better understood, especially among the younger doctors, and just asking around can be the best way. And also checking with your local EDS society too.
Wonderful, thank you. Yes, we do have a medical directory also on the EDS website for the society. We had a comment from Sally, says, thank you, this was brilliant. Thank you, Cynthia.
Thank you.
Any other questions? Any recommendations on how to bring the paperwork with us?
Oh, yes. I have a plastic folder that I use to bring the most important paperwork for every meeting. When I had cancer, I actually had an entire bag where I had my cancer binder and my blood work too, going back multiple years. And sometimes I bring my laptop in case I'm afraid that I might forget something, because most providers now have internet and I can log on if I did forget something. Because of course, one of the problems we have in the United States, at least, is every provider has their own portal, and it can be difficult to remember even to keep everything in one place. But one of the nice things is, at least in the state of Colorado, I don't know how it is everywhere else, unless you tell a radiology place that you go that you don't want your doctors to be able to access it, then all of your doctors can access all of your films and all of your radiology reports, which is super helpful.
Wonderful, thank you. What do you recommend we do for mental health while really struggling with all of this?
So I do have a counselor that I see, and that's been helpful. Taking the medical vacations is helpful. And then having friends that don't have Ehlers-Danlos and don't have my other things like immune deficiency is helpful too. And lately I've taken up a hobby of silversmithing, and it's very meditative. And so when I'm doing the silversmithing, I don't think about anything. And I do yoga as well. And when I'm doing my yoga, I try not to think about anything, but it's not quite as mind clearing as the hobby of silversmithing, which requires 100% of my attention. So I think having a hobby that requires 100% of your attention is really a good thing to do, because you can't think about anything else while you're doing that, whether it be some kind of crafting or some kind of volunteer work that you do or something.
Great, thank you, Cynthia. If there are any other questions, you can submit those by clicking on the Q&A button at the bottom of your screen. You may need to hover over the bottom if you can't see it. I do have another question here. What do you do when you have trouble getting to or traveling to medical appointments you need when you don't know how you might feel that day?
Oh, that's a good question. For me, more of the issue is I end up having a lot of sedated procedures because I have a lot of sinus issues with my immune deficiency. And my mother used to take me, but my mother's moved now. So I just have lined up friends who are willing to drive me. And so I try to pay it forward and take care of other people. Mostly I take care of other people's kids right now because my youngest is 16 and a lot of his friends have parents who work and the kids aren't driving yet. And so I take care of kids in the community, and then people take care of me when I need to be taken care of. So it's just kind of a pay it forward situation.
Wonderful, thank you. Do you have any advice for advocating for your kids?
Yes. So making appointments with the counselors at school once they hit middle school, I think is really important. And my youngest has been diagnosed now with immune deficiency, and because he's such a valued member of the school community, we've not even had to put him on a 504 plan or whichever the academic plan is. We just put a medical plan in place, and the counselor contacted the nurse, and then they contacted the teachers so that I didn't have to spend my time doing that and didn't have to spend my emotional energy doing that. And I also did that when I was diagnosed with cancer, just because I wanted the teachers to keep an eye on my son and how he was doing emotionally, and make sure that they knew that we didn't know how things were going to be for the family. And so we had a secret agreement that my son didn't know that he didn't have any deadlines that year. And we said, well, let's just see how he rises up to the occasion. And he did wonderfully. And we just had one time when he got really stressed out about a project, and I knew he didn't have a deadline, but he didn't know he didn't have a deadline. And so it worked out really well, where keeping him busy was the right thing to do, but knowing that he could take a break at any time if we needed it. And actually, I did pull him out of school one time to go on a family trip, which the family really needed. So I don't know if that fully answers the question, but I think just keeping in close touch with the counselors and the nurses at school, but not expecting that your kids won't perform, because I think our kids are amazingly resilient. And so expecting that they will perform is really the key.
Great, thank you, Cynthia. What do you do when you need help with a really specialized issue but you are on a very long waiting list, several months or even years?
Unfortunately, I think sometimes we do have to wait. And so the only thing we can do then is see if there's another provider in town or even another part of the country. We can ask to be put on a cancellation list and be willing to drop everything for a cancellation. And sometimes while we're waiting, we can just continue to treat symptoms while we're waiting to get into a specialist and hopefully find the root cause and address the root cause of the issue. So I think we have to remember that this is a long-term issue that we're dealing with, and it's a marathon. It's not a sprint.
Okay, thank you, Cynthia. Another follow-up on the kids. Do you have any advice for teaching your kids how to advocate for themselves and take care of their own health care as they grow up?
Yes, because I have a 25-year-old and a 16-year-old. And my 16-year-old, well, we've had the same pediatrician throughout, but I've seen some changes in the pediatrician's office with the 16-year-old. They are helping the kids start to advocate for themselves around age 15, and they're asking the kids to refill their own prescriptions and schedule their own appointments starting around age 15 or 16. And I'm going to start having my 16-year-old make appointment agendas for himself, because he does not talk to doctors, especially now that we're dealing with an immune deficiency diagnosis for him. And he'll tell me after the appointment how frustrated he is, how angry he is, but he won't voice his real concerns to the allergist immunologist that we're dealing with. And the allergist even says, he won't talk to me. And so maybe if you leave the room next time, he'll talk to me, but I haven't experienced that he really will talk to the doctors even when I leave the room. So I think a great way is to start easing them into taking care of themselves by having them look at their medical summary, understand their diagnoses, create those appointment agendas, offer them alone time with their doctors starting at around age 14, 15, 16, and then regrouping with you, the child, and the doctor at the end of the appointment, which is what has been going on with our pediatrician since about age 13, I think, and handling it that way. I was told with my oldest that he would not be fully able to handle his own medical needs until he was 25, and I think that is very true, because he had a surgery when he was in college. He was 22 or something, and he was not able to navigate that by himself. But now he is 25 and he is completely able to handle his own health care.
Great, thank you. We do have an anonymous comment. I wish I had this information when I was first diagnosed. Best webinar for dealing with all of EDS's complex issues I have ever seen. Thank you.
Thank you.
And another question, how do we start with a new doctor when they want your whole life history, but there's such a limited time? We just hand them the folder with the tests? I feel like I have too many diagnoses to talk about.
Right, so that's where the medical summary comes into play. And when I met my new GP, I gave her, I gave her the medical summary, and then I gave her a stack of different papers related to each of my diagnoses, paper clipped together, because she did need a little more information than just my medical summary. And she wasn't in the same medical system as my old GP was, so she didn't have access to those electronic records. And so I gave her a stack of stuff related to my Ehlers-Danlos diagnosis, a stack of stuff related to my immune deficiency diagnosis, a stack of stuff related to my Hashimoto's, a stack of stuff related to my mast cell a stack of stuff related to my breast cancer, because unfortunately I was in the middle of treatment when I landed on her doorstep. And she really appreciated that. She said that she would take time over the next few weeks as she had time to read all of it. And I just laughed and said, well, I just wanted to make sure you knew I wasn't making any of this up. And she said, there's no way anyone could make all of this up. I also have Chiari malformation, and so I had the records to prove that I have Chiari malformation. And so that was a great way to start that relationship off. And we do a lot of our business via email, because really I'm on Medicare now through disability, and so she doesn't have to do any referrals for me. And so I just update her. I can attach things to the emails that I send her. So if I have new scans or something, I can just send them to her. And I see her just a couple times a year, actually, unless things that a GP would take care of come up.
Great. Thank you so much. Do you have any advice for keeping track of your medical schedule, appointments, and everything else with brain fog and other memory issues?
Yeah, I use Cozy, COZI.com. And I use that because I was until recently driving my youngest son around. And so he and I needed to sync our schedules. But I've been told by someone, when I was really dealing with chemo brain, calendars for some reason are something that I really was struggling with and still kind of do struggle with. Specifically, like I will get the day of the week wrong or the time wrong or something when I put it into my calendar. It's just an odd thing. Calendars are just really beyond me since chemo. And so I was told that I really should use a paper calendar, but that makes recurring appointments difficult, and that made coordinating with my son impossible. So it's not something that I've gone back to using, but that is what I've heard the best thing is, if you're really struggling with brain fog, is to use an old school paper calendar.
Okay, thank you. Any thoughts on electronic records or medical ID company or thumb drives versus paper?
Oh, so there's a company called Medical Alert Foundation that is, it's medicalert.org, I think. And they will store your electronic records. And you can even upload a DNR, medical durable attorney, all different kinds of things to them for an additional fee. And they give you a unique ID, and no one is supposed to work on you until they call the 800 number and ask for your information. And I use the service because for me, even my allergies don't fit on a regular medical ID. And so it's just a great idea for me. You can purchase a bracelet, you can purchase a necklace, they give you wallet cards, and even a sticker you can put on your car. And my husband would never remember all my medical stuff. So I've told him, just don't even try. Just tell them, oh, she's got a bracelet. Just look at her bracelet. And so I think that's a great service. I've heard that I had a thumb drive for a while, a thumb drive bracelet, but I've heard that medical professionals won't use those because of fear of viruses. So I went away from using that. I do try to keep a medical summary with me most of the time, and I do always bring one to an emergency room or urgent care when I'm going there, just because, again, it's a really easy, quick way for someone to read about me without me having to tell my story again. And they can read faster than they can hear it, and they really appreciate seeing that summary.
Do we have any other questions? Not, it is about three. Oh, here's one. How can you get your primary care provider to understand complex and debilitating EDS can be? I'm trying to find a new care provider, but in the meantime, I am really struggling to get the help I need with referrals, prescriptions, and the basic understanding.
So in that case, I would recommend if you have any providers that are working for you, that you ask them for help in, if it's a primary care that you're trying to find, that you ask them for recommendations for a primary care that might work for you. One of the things that I've found in having to find a new primary care provider who took Medicare, which is quite hard in Colorado, most of them don't, is that I really like my primary care who's at a hospital, because she can give me more time. She can give me a 30-minute appointment, and whenever I make an appointment, she does give me a 30-minute appointment. Whereas my old provider never gave me more than 15 minutes. Even when I asked for a longer appointment, I was always told, no, that's not the way we work here. You get your 15 minutes, that's all you get. And so one of the things about providers who work for a hospital is that they're on salary from the hospital, and they seem to be really happy because they're not overworked maybe the way some of the other providers out there are.
Yeah. One last question. Is there a template for a medical summary?
When this gets posted, you might be able to read what I put on there, but on the slide, there is a template.
Okay, great. Thank you so much, Cynthia. That is all the time we have for today. You were wonderfully helpful, as we had some wonderful comments that we were able to share during the webinar. Thank you everyone for being here. As a reminder, this webinar has been recorded and will be uploaded to our YouTube account with all of the slides within a few weeks, technology permitting. Thank you all for attending, and have a wonderful day.
Thanks, everyone.